Breastfeeding is the most important thing you can do for a baby because it is the natural earth-made compound for the baby's growth. It has all the nutrients, absorbable vitamins, and this awesome ingredient called secretory IgA, which none of the formulas can reproduce. And it actually gives the baby's intestinal system immunity to fight off infections. It's the easiest thing to do, is the least expensive. Definitely 1 year if you're able, even longer.
We like to encourage new moms to breastfeed their babies. If they don't breastfeed, then they will bottle feed their babies, but we're very proactive in terms of breastfeeding. When the mom is breastfeeding her baby, they really bond nicely. They become even closer, and that's very, very important. That ensures that the baby gets off to a good start psychologically, knowing that the mother is there to care for them. The baby's immune system is affected by breastfeeding. We know, for example, that when babies breastfeed, they have far fewer ear infections and upper respiratory infections in the first months of life. When a baby takes either mother's milk or formula, they're going to get a little bit of air as well as liquid. So if they're breastfeeding probably every 5 to 10 minutes, it's a good idea to just stop and burp the baby, and the same if they're bottle fed. There are simple ways to burp a baby. I think most people are familiar with putting the baby over their shoulder and gently patting them on the back, and that usually loosens a bubble and the baby will burp. Sometimes a baby just doesn't burp after a few minutes of patting them on the back, and then it's probably okay to go ahead and continue the feeding. Sometimes babies will have a negative reaction if the mother is consuming caffeine. So that's coffee, tea, chocolate, sodas, and I tell them, well, if you think your baby's having a negative reaction, eliminate those from your diet, and if the baby improves, then you pretty much got your answer. That you need to leave those out of your diet.
I remember one time when pathologists used to teach us in medical school that what burns your mouth does not burn your stomach. The breast milk content, the human breast milk content, is the same in any continent in the world. So the foods of Asia or Africa or the Americas still make the same amount of ingredients in the human breast milk.
Alcoholic beverages probably should not be consumed in great quantity if a mother is breastfeeding. I think a glass of wine once in a while is okay, but for the most part, alcoholic beverages should not be consumed during the time you're breastfeeding your baby.
Most newborns will want to eat every 2-3 hours if they're breastfeeding, sometimes as early as every hour and a half. And as your milk comes in and your breastfeeding is established, the baby can go on a schedule of perhaps every 2 to 3 hours during the day and 3-4 hours at night as the baby allows you.
Could breastfeed, that's wonderful. However, if you can't breastfeed and your milk does not come in, contact your doctor because they could get a lactating specialist help you. If for some reason you still can't breastfeed, please don't feel guilty. Again, it's common. Some women don't make enough milk, and then of course they're going to teach you how to supplement your baby. Bottle-fed babies still do well, so don't feel guilty. But if you had a choice, of course, try and breastfeed.